Hello folks, this is part 2 of the Mycoplasma pneumonia lecture, and today we will be focusing on the symptoms and treatment of the disease. Now going straight into the symptoms. Even when you're infected with the same bacteria, Mycoplasma pneumonia, the type of infection may vary and accordingly symptoms may be a bit different. Age is also a factor that influences the severity of the symptoms. One of the most common types of infection caused by the bacteria is tracheal bronchitis, which we commonly refer to as chest cold. Most prevalent among child hosts, chest cold includes symptoms such as, but not limited to, fatigue, headache, cough, and a sore throat. These symptoms may manifest after 1 to 4 weeks from the date of infection. And although rare, the host may be infected with fatal forms of pneumonia, the symptoms of which may include chills in addition to symptoms of chest cold. The likelihood of developing a severe case of pneumonia increases if you have asthma. Untreated Mycoplasma pneumonia may therefore lead to respiratory failure, lung consolidation, acute respiratory distress syndrome, and much more critical outcomes. Other types of infections include ear infections. Mycoplasma pneumonia, being a walking pneumonia, can oftentimes be recovered without antibiotics. In most cases, patients simply make use of over-the-counter medicines during the process of recovery. However, in cases of more severe forms of Mycoplasma pneumonia, antibiotics may be prescribed. The most widely used type is microlides, used both on young and older children and adults. Although microlide resistance has been reported throughout the world, with particularly high rates coming from Asia of 90% to 100%, it is still agreed upon by experts that microlides are the best antibiotics of choice for treating Mycoplasma pneumonia. For older children and adults, antibiotics tetracyclines are used, and if a patient is unresponsive to the two aforementioned antibiotics, they are treated with fluoroquinolones. Under normal circumstances, tetracyclines and fluoroquinolones are not prescribed to children, hence why proper use of microlide drug to prevent microlide resistant strains of MP is important.